life problems when we operate patients with multifocal lenses and follow them up with some problems that may occur later in their life. So what we now do is we currently use 7 different IOL models, and we all know that there would be inappropriate candidates for multifocal IOL implantations up front. Some of them would probably be very, how to say, absolute contraindications, where some of them may be relative in terms of patient demands and our judgment whether or not this should be done or not. So, and we all face the problem: what if you have operated patients in conditions that was allowing it, and then pathology develops later on? So what do we do then? Will the patient suffer from serious reduction of contrasensitivity, or do we need maybe to replace the IOL? Once probably we also done the eye laser, which is probably difficult to do. And there is a paper of meta-analysis of 247 papers, and they actually ask this question: whether or not implantation of multifocal lenses should be how to say, advised against multifocal lenses if there would be some retinal comorbidities. And actually they couldn't really, in these 247 papers, find enough evidence to say that we should be actually advised to not implant multifocal IOL. Of course, not up front, but I would say that this paper gives us a little bit more confidence that even if the development of posterior segment problems later on occurs, that perhaps we are not that liable for the problems that actually are coming from the, let's say, pathology itself, and it's not probably the cause in the lens itself. But of course, if we are doing refractive lens exchange, that is a little bit more tricky area, because you operate there on, let's say, healthy eyes, I would say, and you should be aware of the problems that may actually occur after this refractive lens exchange. Right, what I would like to show is 5 cases where we have this kind of comorbidities, and one was pseudo-vitelliform macular degeneration, second was high myop that developed retinal detachment, and then third was retinitis pigmentosa case that developed CME and full thickness macular fold, then RLE case that developed CME and ERM, and ERM case that spontaneously resolved after the ACE inhibitors. So the first case was the very first patient that we operated with fine vision lens in 2012, and that gentleman at the age of operation was 79, and he had advanced cataract with both eyes of 0.3 vision. Fundus had some small bruising. However, he really was motivated to have multifocal lenses, and his results were actually very good, and he could reach JA1 with almost full vision. And then 4 years after, he developed this kind of maculopathy, which was defined as pseudo-vitelliform maculopathy. There was not any signs of developing wet AMD. And this gentleman, 7 years later, after cataract surgery, could still read very well. His vision was worse on the affected eye, but he could still read with both eyes, and he didn't really have any serious problems with that.